We are here today with Dr. John Anderson, a UK medical specialist who graduated from the University of Edinburgh with a Master's of Science in Internal Medicine. In addition to his MBBS from the University of Guyana, Dr. Anderson holds an Associate of Science degree in Pharmacy from the same institution. Furthermore, he owns a company called the Center of Healthcare Excellence Inc. Prior to acquiring his present position, Dr. Anderson practiced pharmacy for a decade. In other words, he has over 2 decades of experience in the health sector.
So H. pylori is the shortened form for the organism Helicobacter pylori. And Helicobacter pylori is a rod-shaped bacteria. It's the most common infection in human beings, and in fact more than 50% of persons in the world are affected by H. pylori. And so this organism, Helicobacter pylori, or H. pylori for short, is responsible for causing issues in the gastrointestinal tract, mainly the stomach and duodenum, which then manifests as disease conditions. H. pylori can cause conditions such as peptic ulcer disease, and that is a broad term for ulcers in the stomach and the duodenum. And those two have their own mechanisms in terms of what the organism does in the stomach and what is the resultant that then happens in the duodenum. But suffice it to say that it causes peptic ulcer disease, or can cause peptic ulcer disease, which covers 2 conditions, that is gastric ulcers and duodenal ulcers. There are other conditions that are caused by this organism as well, and that happens mainly when persons are untreated or ineffectively treated, and those are cancers. It can cause mucosa-associated lymphoma, and it can also cause a gastric carcinoma. So it is by no means a benign organism. And so if you are infected with H. pylori, we want to treat it and eradicate it completely. The symptoms of this bacteria is based on what condition it causes. So if H. pylori results in peptic ulcer disease, persons will experience epigastric pain. That is pain just under the breastbone, as we would say locally. And that pain will be a burning chest pain. In addition to that, persons can tend to be bloated. They can tend to pass gas very frequently. Persons can tend to feel very full quickly, so they don't complete the meal, depending on whether they have a gastric ulcer or a duodenal ulcer, because the 2 ulcers, because they're located differently, the person's tolerance for food is different as well. So that manifestation can give us a clue whether the patient has a peptic ulcer or a gastric ulcer or a duodenal ulcer. But in general, patients can experience early fullness, we say early satiety, when they're consuming their meal. In addition to that, some people will experience nausea, or we say in Guyana bad feelings, and vomiting. So those are some broad symptoms. Of course, if the person develops a cancer, then that will present differently. Persons tend to lose weight, they can become anemic, they can be very ill appearing, and so on. So it depends on what this bacteria causes that will result in the symptom that is seen. The diagnosis of H. pylori can be done in an invasive or a non-invasive way. The invasive approach to diagnosing H. pylori is by endoscopy. That is where your doctor will put a tube which has a camera attached to the end, and in addition to the camera, it may have other pieces which can take a biopsy. So you can have pieces that can take a biopsy, and also a camera at the end. So some endoscopes are just for making a diagnosis, and some endoscope can apply treatment and also take samples. So when your doctor puts that tube into the stomach, so it goes into your mouth and it goes into the stomach, that doctor can see the different parts of the stomach, Your doctor can see whether there are ulcers in the stomach. Your doctor can see whether there is any bleeding in the stomach, and they can go beyond the stomach as well. So we can do it by endoscopy. So the endoscope will be used to remove a sample. That sample can be cultured, which means that we grow the tissue that we take from the stomach in a special medium, and that can grow H. pylori, which is then tested later on. In some cases, we can do histology, where you look at the sample under the microscope, and that also can give us a diagnosis. And then in other cases, you can do testing which allows for a chemical change when the tissue is placed in certain chemicals, and so that can also tell us if the person is infected with H. pylori. So that's the invasive approach. And then there's the non-invasive approach, in which case we can use blood, we can use whole blood, or we can use serum. Well, doctors know what that means, but basically we can use blood, and we can test the blood for immunoglobulins, which can indicate the presence of H. pylori. In addition to that, you can do what is called the urea breath test. You can blow into a tube, into a special machine, and that machine can pick up traces of urea, which the organism produces, and that can tell us whether the person is H. pylori positive. We can also do what is called a stool antigen test, and that also can tell you the patient is H. pylori positive. So you have all of those approaches, with each having their own advantage and disadvantage in terms of how sensitive and specific they are, and also how invasive or non-invasive they are, as the case might be. The modes of transmission includes fecal oral, as in, if in most countries that are not well developed, persons will dispose of waste, human waste, in a manner that is not always appropriate, and so it can get into waterways and so forth. And so that's one mode of fecal oral transmission. And vomit and oral fluids also can carry H. pylori in persons who are colonized by H. pylori bacteria. And so if you have a child, and that child vomits, and you are taking care of that child, and there is no hand washing, there is no good sanitation, then if that child is colonized, you can also become colonized. So you have fecal oral, you have oral. So once you're in a relationship with someone, one presumes that you will be intimate, and therefore salivary transmission can occur there as well. Now, someone may not know that they are colonized with H. pylori unless they have symptoms or unless they're tested. We don't screen people for H. pylori, but when symptoms occur, we do check. And so two persons in a relationship can be infecting each other with H. pylori and not be aware. And so that has implications for treatment, because if you're treating one party and you don't treat the other party, then it means that you're going to have reinfections. There's really no way to prevent yourself from coming into contact with H. pylori, because H. pylori doesn't have a face, and therefore you can't say, oh, that person is H. pylori colonized or H. pylori infected, therefore I'll stay away from sharing a cup or something with that person. So it's a case where you don't know until symptoms occur. But what is important is that when patients are infected with H. pylori or diagnosed with H. pylori infection, that we ensure that we treat thoroughly, because they are resistant strains of the organism which does not respond to normal courses of therapy and the regular medications. There are different forms of therapy for H. pylori in terms of the combination of medications that we use. So in some patients, we use what is called triple therapy, and in other patients, we use what is called quadruple therapy. There are other forms of therapy as well, but those two are the main forms of therapy. So what we do, we use an antibiotic, and the drugs used are amoxicillin, we use metronidazole, we also use levofloxacin as well. So, but commonly, amoxicillin is used 1 gram every 12 hours, and we also add what is called a proton pump inhibitor which is like omeprazole, pantoprazole, esomeprazole, etc. We use omeprazole here in Guyana, and pantoprazole also. And those are given in their usual dose, but twice a day. Those are the approaches that we take. And usually people get cleared, all right? But you have to return to your doctor for evaluation to see if you've cleared the organism. And the two tests most commonly used for confirmation of cure are the urea breath test and the stool antigen test. What you find is that some persons go and they do the serum analysis, which is a serology, and you would have the presence of antibodies once you have encountered the organism. So they can have a false reading, in which case, you will be told, oh yes, you still have H. pylori infection. But really, the antibodies are there because your immune system interacted with and produced antibodies to protect you from this infection in the future, or to respond more efficiently if you come into contact with the bacteria again. The treatment goes for 2 weeks, subsequent to which you stop all treatment, and then you wait for approximately a month, and you can retest. Okay? You can retest using the appropriate test. And once you're cleared from H. pylori, then only if you come into contact with the organism again will you have symptoms which will cause you to visit your doctor again. First off, doctor-patient confidentiality as it relates to a diagnosis of any kind, including H. pylori, must be ensured and must be upheld. So that if you go to your doctor and your doctor diagnoses you with H. pylori and you are treated, that is completely a confidential arrangement. So you don't go necessarily, unless you have a partner or other people who you think are exposed, you say, okay, look, you need to visit the doctor, just get it checked. So in terms of discrimination, like I said, H. pylori doesn't have a face, and therefore you can't necessarily know. But the hysteria that can result, where people can be so scared now, yes, one should be very careful as it relates to the hygiene practices that we should be adhering to. So we really should not be, just taking somebody else's spoon that they're eating with and just start eating from their food. We live in a society where people are very open and very, that those things do happen. But it's not necessarily the most hygienic thing to do. So, if you know that someone is H. pylori positive, it just means that person would have had to go for a diagnosis first off, and that person would have received treatment, because no doctor I know would diagnose you with H. pylori and then say, okay, go home and have a good day. Okay, so unless someone is told that another individual has H. pylori infection, you would never know.